This video will walk you through the Colorado State Drug Assistance Program, SDAP, and how to apply online or through the Ramsell app. To skip straight to the application instructions, please click the link in the description below or skip to the next chapter in this video. If this is your first time applying or learning about SDAP, we will walk you through the program details. For people living with HIV, taking medications as prescribed is essential to maintaining good health. These medications are expensive, but we're fortunate to have both federal and state government assistance to help our patients pay for these life-sustaining medications. One of these assistance programs is the Colorado State Drug Assistance Program, or SDAP. SDAP was previously called the AIDS Drug Assistance Program, or ADAP. Patients apply for this program either through a paper application or online through a website or mobile app. Patients can apply with the help of a case manager or by themselves. This video will help you learn how to apply for SDAP online. Before we go over how to apply, let's learn who is eligible for SDAP and the kinds of assistance SDAP provides. In order to qualify for SDAP, there are 3 specific criteria you need to meet. First, you have to be a Colorado resident. Second, you have to be a person living with HIV. Third, your household income must be equal to or less than 500% of the federal poverty level. Federal poverty level guidelines are updated each year and can be found on the SDAP website. There are 4 different programs under SDAP. After you apply, SDAP will figure out which program you qualify for. The first program is called HIAP, or Health Insurance Assistance Program. If you have private insurance from an employer, a marketplace plan, or COBRA coverage, this program can help pay for your medical insurance premiums, co-pays, co-insurance, and deductibles. Enrolling in this program will reduce the amount you have to pay out of pocket for medical visits, labs, and medications. If you are uninsured, you can go to Colorado Health Network during open enrollment to enroll into a marketplace or off-marketplace insurance plan paid for by HIAP with no out-of-pocket expenses for you. The second program is called HMAP, or HIV Medication Assistance Program, and is for uninsured individuals to receive financial assistance to pay for HIV medications only. The HMAP program only pays for medications and will not pay for medical visits, labs, or other services. HMAP only covers medications on the SDAP formulary, which is a list of prescription medications covered by SDAP. Please scan this code or click the link in the description to see the SDAP formulary. The SDAP formulary has more than just HIV medications. It includes many other common medications to treat a variety of health conditions. If you need a specialty drug that is not on the formulary, a prior authorization can be done by your provider for an exception to be made. SWAP, or Supplemental Wraparound Program, is for those on Medicaid. This pays for medical visit copays and prescription copays. We encourage everyone on Medicaid to apply for SDAP. If you are on Medicaid, you do not have to provide any supporting documents and only have to fill out the basic SDAP application. If you have a lapse in Medicaid coverage, being enrolled into SDAP will still allow you to pick up medications until you reapply. The last program is SPAP, or the State Pharmaceutical Assistance Program, which is for patients with Medicare. This program provides financial assistance for Medicare Part D and Medicare Advantage Part C programs for SDAP formulary medications. Now that you know the eligibility criteria for SDAP and the kinds of assistance SDAP provides, we will go through how to apply for SDAP online. Applications are done through a website called Ramsell. You will access it at www.coenroll.com, or you can download the Ramsell app in the App Store. If this is your first time applying online, you will hit the Register button. If you have applied for SDAP in the past through a paper application or case manager, you will first need to get a verification code to complete the registration. You can get this code by calling the SDAP Help Desk at 303 692-2716, or speaking with your case manager. If this is your first time applying for SDAP in Colorado, you do not need a verification code. In order to complete your application, you will need proof of residency, proof of income, and your insurance card. Please have these documents ready. You will need to upload them at the end of the application. In each section, we will go through documents SDAP will accept. For a complete list of accepted documents, scan this code or click the link in the description below. Fill in your demographic information. For your name, please use your legal name found on your identification documents. If you go by a different name, you can put it in the Name You Prefer to Be Called section. If you don't have a Social Security number, skip this field. Any resident of Colorado can apply for SDAP, regardless of immigration status. SDAP does not share immigration status with anyone else, and applying for SDAP won't impact the immigration process. Everything with a red asterisk is a required field. You won't be able to go forward with the registration process without filling in all the required fields. Proof of residency can include a state or government-issued ID with your name and current address listed, a utility bill, a mortgage statement, or a lease agreement. SDAP cannot accept cell phone, insurance, other bills, or any general mail to satisfy this requirement. If none of the acceptable documents are in your name, provide any of the acceptable documents along with a note from the person who receives them in their name, stating that you live with them at that address. If your roommate is not able to write a letter, please call the SDAP Help Desk for guidance at 303-692-2716. After you complete the demographic section, you will move on to providing medical information about your HIV diagnosis. It's okay if you can't remember the exact date of your diagnosis. Please put your best guess for each of the questions. Next, you will provide information about your medical insurance. You will need your insurance card for this section. You will also need to upload a copy of your insurance card at the end of the application process. If you are unsure what kind of insurance you have or get stuck in this section, please work with your case manager or another clinic staff member. As a reminder, SDAP can help you pay for insurance premiums. Please mark yes to "Would you like to receive information on how the program may help pay your premium?" if you are interested in learning more. If you are currently employed but not enrolled into employer insurance, you will need your employer to fill out the employer insurance information form. In the next section, you will provide your income information. As a reminder, your household income must be equal to or less than 500% of the federal poverty level to qualify for SDAP. Please have proof of your income available, as you will need to upload it. If you are married, you will also need to provide your spouse's income information and proof of their income. If you report no income, you will need to fill out the Statement of Support document. The income section can be challenging. If you get stuck at this part, please work with your financial screener, case manager, or call the SDAP Help Desk at 303-692-2716 for support. For proof of income, you can use 1 month of paycheck stubs from your current job. These must be less than 6 months old. If you file taxes, you can use a copy of the first 2 pages of the 1040 tax form from the IRS for the most current year. If you are receiving Medicare, please provide your current Social Security award letter and proof of any other income from job pension, annuity, or private retirement, or if you filed taxes, a copy of the first 2 pages of the 1040 tax form from the IRS from the most recent year. The last section is the Documents section. In this section, you will upload your proof of residency, insurance card, proof of income, statement of support if applicable, and employer insurance information form if applicable. After all documents are uploaded, click Save and Continue. You will be taken to the Other Information section. In this section, you will be asked if you want to opt in or opt out of data sharing. Opting into data sharing allows other agencies serving patients living with HIV to see that you are eligible for other services without having you submit eligibility paperwork again. Choose Opt in or Opt out, then hit Save and Continue. The last page is a confirmation page. Please review that all information provided is accurate. You will confirm, sign and date, and submit. If there is anything missing from your application, someone from the SDAP office will reach out to you and let you know what is needed to complete the application. SDAP applications are typically approved for 1 year unless you are applying outside of your birth month. You will renew again on your birth month every year. We encourage you to set a reminder. After your SDAP application is approved, you will receive a card in the mail. This card acts as proof of eligibility for HIV clinical services, case management, and other wraparound services. Please present this card to your provider. We hope this video helped you successfully apply for SDAP. Thank you.